Burr. It's cold out. It's 49 degrees. You guys up in Michigan are getting slammed. Oh, I'm glad I'm not a Michiganer. Woo-woo. But I'm sure Indiana, Ohio, up in there are getting a little bit too. Oh, man. Ooh. Hello, my dear ones. How are you today? Today is Tuesday. I filmed all day yesterday in the spiritual side of naturopathy. I've got about another half hour to add to that, maybe 45 minutes, and focusing in on how creation is put together, but the importance of understanding the mind and emotions and their obstructions to getting well. You notice that getting healthy isn't just a physical experience. And a good naturopath is going to understand a little more how an individual's put together. We talked about this before. You know, when you look at from a human to a human, you're really just looking at body to body. You've got to look at the soul or the awareness, and that's who you're talking to, through a mind and through emotions and through the physical eyes. So you've got several eyes looking at you when you're looking at someone. If I'm looking at each and one of you, I'm looking at your physical body, I'm looking at your astral body, I'm looking at your mind, and then I'm looking at who you are. And then you can see how you use your mind, how you use your emotions to navigate yourself with the physical body. They're so intertwined, it's hard for people to see any difference. That's why allopathy believes that the brain is the mind. Really. Where's the emotions at? The heart. We know it as the adrenal glands, don't we? Absolutely do. Oh my God. So I'm hoping you'll like it. It's only going to be a little over 2 hours long, so it won't be a real long class, but fun stuff to know. You know, like I said, I was an out-of-body teacher years before I became a naturopath. And so I don't remember any spirituality taught in my naturopathic school, although holistic and the higher levels are expanded. Spirituality just means more of an expanded, less conditioned way of viewing life. You know, the trouble with the mind and emotions, they're both conditioned states. Your mind is just your computer you're using. It's not you, it's your computer. And your life experiences is being recorded and then categorized and acted upon. That's why you have the Akashic records in the causal world and stuff like this. You can see all that you're learning and perceiving, and the computer, the AI, the mind is the greatest AI there is. And it all works with duality, positive and negative, acid and base. Anyway, let's see how we're doing out here. This is Moses. Male 29, 5'4". My friend, you're a short male. So we would definitely be looking at pituitary, you know, definitely. He's 161 pounds, chronic fatigue, balance issues, brain fog. So 5'4", we know that the pituitary is involved. And through our discussions in our videos, I've tried to get you to relate back to the embryonic trunk and how the GI tract was formed, and the fact that the transverse portion of your colon relates to your head, right? So as the bowels are degraded in genetics, so are the reflex. That's why you see those black radius solaris coming out of the pupil, out of the bowel area or stomach area, radiating all around the body, particularly up. And that's where you begin to look over to the cerebellum and mastoid area. He's got balance issues here. And so this is why we always go after the GI tract. That's kind of your original embryonic trunk thing. We're going to always go after cleaning and enhancing the function of those cells of the gut. But at the same time, then we're going to get up in here to the pituitary and work on that as well. Try to get the lymphatic system drained, because a lot of people have had cheeses and dairy products and yogurts and milks and stuff like that in their life, clogging their head areas up. So we're going to go after kind of opening those pathways up. Brain fog and all that just tells me that his lymphatic system is down in the head area. Because to bring the pituitary down, it's like saying your pituitary is a normal pituitary. What brings it down to where it doesn't produce your growth hormones like it should, so you end up shorter than let's say, other humans. Not that it's bad, it's just what impedes or shuts down the ability of cells to perform their function. Because remember, cells are structure, function. Blood isn't function other than feeding the cells. It's energy. And the lymphatic system fluids are your sewer fluids. So you have to look at the cells. That's the everything of the body is the cells. And so when you see a cell that is hyperactive, like in hyperthyroidism or hypothyroidism, what enhances or stimulates the thyroid, or what makes it hypo? And the same cytochemistry can do both. Acids. And it's always the lymph system. The blood is always alkaline, or trouble in the house. So when you look at this outside of foreign chemistry, excitotoxins, hemotoxins, neurotoxins, except for those impeding and breaking and sitting down on cells, then you have the lymphatic system that is involved in shutting down the ability of cells to function, or hyperstimulating. Acids can hyperstimulate. They look at estrogen and testosterone, a minor acid, but it can stimulate. And chronic fatigue, that I would be going to the adrenal glands on this one. You can, medical people blame it on Epstein-Barr virus and stuff like that. That stuff's so easy to clean out of the body, it's not even funny. Really, when you look at a 5'4" individual, you're going to be looking at those adrenal glands just because of the pituitary as well. So that's, and in today's world, he's 29, I'm going to go to his kidneys, because it's just, to me, and seeing as many people that we've seen through all the years, and our students, I doubt seriously that there's a healthy 29-year-old in terms of kidneys and adrenal glands. Maybe. And it just fits. This is about himself. For the past 7 years, I have had an off and on feeling like I'm on a boat when I walk. And that brings me right back to the back of your head, man. And it's like, no, this is what you don't want. Because with chronic fatigue, you want, let me see. Oh, just what I thought, though. Just what I thought. Thank you, Moses. Look at the eyes. What do you see? What are these? Nerve rings. So your nervous system, my friend, is chronic. Your nervous system is like that little choo-choo train that says, I think I can, I think I can. That's your nervous system. That's chronic. Well, let me see here, real quick here. Yeah, I mean, right eye, you back at the right ear area, you've got some weaknesses, some minor weaknesses up in the cerebellum, mastoid. Left side the same way. Got a lot of chronic lymph in the back of the head on the left side in particular. So that's going to, and then up in the brain itself, definitely pituitary. Sinuses are chronic. that sort of thing. And with a chronic nervous system, the autonomic, all this is going to bring you into this. The problem with this sort of thing is it can be the setup for ALS, Lou Gehrig's, MS, and Parkinson's and stuff like that. The pupils are very small, my friend, especially for the neurological weakness. The more weakness you have neurologically, the bigger the pupil gets. And yours is real tense, showing me that your body is very acidic. And look under these nerve rings here. See how light brown that is? That's his true color. Well, your true color, Moses, is light brown. See it over here as well. So all this thick, darker brown stuff is your lymph system. You have a very chronic lymph system. And then up here in the sinuses and the pituitary area, see how dark that is? Back of the head here. Yeah. This is also maybe influencing the left shoulder. Well, while we're looking, yeah, you got chronic adrenal glands, no question. The right kidney is a little bit of chronic itself, a little right femur, maybe a little right hip and groin involved here a little bit. Mid-lobe bronchial trunk right side, a little chronic weakness in that area as well. But as you get up more in the mastoid on the right side, more cerebellum on the left. I think you have pressure on the heart from the bowels. I think you also have a little spleen weakness. So, you know, that's a lymphoid organ. That's how the blood cleans itself, but that's also your platelets and white blood cells. On the left side here, you've got, in your groin, you have a lot of chronic issues going on in your groin here. It's like you're not moving your lymph up through your groin properly. Definitely chronic adrenals. Kidneys are not that bad. I got a knee on the left side, groin big time on the left side, your throat. Yeah. Skin, you know, your skin's a little beat up, my friend. So you could have a low thyroid involvement. That comes along with fatigue, and a day that the balance issue is gone, the fatigue is also. Yeah, that just shows you the nervous system. Some days your adrenal glands are probably popping and hopping, and some days not so much. And you can see that kind of like a Brady-Tacky syndrome. I also have some brain fog and vision issues, like when I close one eye, I see dots with the other, and I can't see clearly. Yeah, you really need to detox the head up. Get your body hydrated, get your lymphatic system moving, because to me you show a pretty involved lymphatic system. Because your eyes should be light brown, and you only see that through your nerve rings. And you got a lot of chronic lymph in the upper portion of the colon, not so much all over the colon. I find that eating certain foods triggers it sometimes, and sometimes urinating triggers it. Yeah, I wouldn't doubt it. You know, you've got a lot of nerves dealing with the kidneys and the bladder in particular. A lot of nerves going everywhere, up the trunk and everything else. So I've tried more than 50 different supplements. Most don't help. This is a good reason that I didn't use too many supplements early on because I've always been an herbal guy. From the time I had health food stores, then I got my degrees and then went into counseling and stuff. I really was more herbal, but I didn't have my own line of herbs then. And finding herbal formulas and stuff for what you wanted back in the early 70s wasn't easy. I think there was a Pennsylvania herb company had some herbs, but very few in those earlier years like that. So I had a supplement line, but I found the same thing. And then later on I had patients bringing me bags of supplements and asking me to tell me which ones would work, and I just threw them all away except the herbs. And we talk about the herbs in this spiritual class and help you to understand more about the power of herbs and the different levels they work on. But that's the problem. That's why I love botanicals. Like for you, nerve power would be very important because nerve power is like a tonic as well. It also enhances. It's got some of the greatest neurological herbs on the planet. So it's great for enhancing the nervous system. At the same time, you want to think endocrinology. Your endocrine glands are, your adrenals are chronic. Your pituitary looks a little chronic, and that sort of thing. So that can impede your thyroid, parathyroid, all the other glands as well. So very important to work on nerve power, the endocrine gland. If you've never killed parasites, I would get the first kit. That way you're sure to get the kidneys, the lymph, the endocrine glands, and the bowels, because you need to work on all those. All those are essential for you. Then you can clean the liver out a little bit if you wanted, the pancreas a little bit. That's here nor there for me in your case. I would be wanting to look at that nervous system. I'd be wanting to try to get that lymphatic system draining through those kidneys of yours. Someday you could hit a little lung there and help maybe that area. But all points lead to because you have fairly good genes. All points would lead to getting your lymphatic system moving through your kidneys, enhancing your endocrinology, no question, especially your nervous system. Getting this area of the back of the head, this bowels cleaned up. Getting that lymph system hydrated and moving out of your head where you can start freeing up and you can start seeing things better, hearing things better, perceiving things better, things like that. Because you're more chronic there, lymphatic, than in other places in the body where you might expect you to be. I keep on digging for more info to figure out what's causing my symptoms. You don't have to dig too far, because there's nowhere you can find the truth except here and in our school and things, because if you don't understand the lymphatic system and what acids do to you, the symptomology of acids building up interstitially and its impact on the cells, whether it's an endocrine gland cell tissue or an organ like a liver or whatever, then you think that you're treating some kind of phantom disease that has struck you. And that's further from the truth. Your physical body is simple made, and a product of genetics always. So you have to look at that. But the two fluids of the body, of course, blood and lymph, blood is not the one that hurts you. Unless the lymph then impacts it and then you start to see problems, or you're bringing in chemistry into the blood that's hemiotoxic, And you have to look at that, but in your case, it's easy to see your nervous system is very chronic. You're autonomic. That's your autonomic nervous system. Breathing, that's your autonomic nervous system. Reaches up into the head, the eyes. Your autonomic is your worker bee. Anytime you see movement or activity, kinetic activity, that's the autonomic. Your central nervous system is the overseer. Hypothalamus, your antenna of the pituitary, and that sort of thing. So when you start seeing brain fog, you start seeing that, you're being pulled down neurologically and also lymphatically. And then when you start having vision problems and all this sort of thing, because again, the one system that destroys the human body is the lymphatic system. The one side of chemistry that's the notorious side for breaking down the body's acids. So when your body translates, that's what breaks it on down, all the acids and bacterium after the acids and all that sort of thing. And of course, back of the head, you do show weaknesses in back of the head, and the cerebellum on one side, the mastoid on the other side. But that looks more chronic lymph than it is genetics and tissue. I would need a more deeper look into the eyes, though. Balance issues that come along with fatigue, and some vision issues that are some days better than others. I had an iridology analysis done, and the iridologist wrote that she sees some sort of trauma to the neck, or it can be from chronic stress. What? Yeah, all I can say is not all iridologists are cut from the same fiber, especially a German iridologist. Sorry, not my cup of tea. Wrote that he sees some sort of trauma in the back of the neck. Trauma? I see chronic lymphatic buildup. I see some genetics in the cerebellum and maybe some minor in the mastoid. More lymphatic stagnation than anything. Mostly affected our pituitary pineal glands in terms of cellular weakness, because you got pretty good genes there. Yeah, I think once you open up this lymphatic system and you get your head drained a little more and the sinuses drained, get these bowels cleaned up as well, you're going to feel a lot of differences with that. But also, you have nerve rings. And for an iridologist, that'd be the first thing you see. It sticks out like a sore thumb. Whoa, look at those nerve rings. I mean, look. I mean, that sticks out like a sore thumb. The neck can come from chronic stress. Chronic stress, all right? So anything that comes from chronic stress is going to affect which glands? The adrenal glands. So stress affects the adrenal glands, which sits where? Oh, on top of the kidneys. And the kidneys are what? Just sitting there looking pretty? You have an extra one just sitting there doing nothing? No, they're your main eliminative organs of your sewer system. And so you shut those down, your sewer system backs up, and then of course your symptoms are going to accentuate, especially when the cup is full. It's just going to bring more acidosis in the body as cells continue to create waste. And so that just creates more pressures, more problems, and more inflammatory responses and things like that. Also lymphatic congestion and a lack of circulation in the neck area. That's interesting. A year ago, I had a test with a quantum machine, and it said I had lack of blood flow to the brain. Well, you know, if you had too much of a lack of blood flow to the brain, that you could see a lot of ischemic problems, more strokey type problems, numbness and stuff like that. I'm going to put my money more on your lymphatic system in the brain. You have a lot of chronic lymphatic system built up, a lot of chronic acidosis. Or we could substitute the word inflammation if you wanted. You have a lot of chronic inflammation in the head area. If you're worried about blood flow, take the blood formula, the circulation formula. That'll help move blood around, but that doesn't help move lymph. Now, you know, if you've got affordability, doesn't never hurt to take the circulation formula. Bringing alkaline blood into areas more aggressively doesn't ever hurt. But you have to get your sewer system moving, or you're doing it in vain. In the past, nicotine patch and caffeine have somewhat improved my symptoms. Stimulants, you know, just stimulants. That's why people that are on all raw meat, they think they feel a lot better, and it's only stimulants. And then the day comes. It's like taking Red Bull. I know a lot of car salesmen that think they'll just suck down Red Bull, right? And I said, you guys will be in seeing me one of these days. I went to a chiropractor after a very brief evaluation. He told me my issue is atlas, misalignment, or something like that, and he said it affecting my cerebellum, and he did some adjustment, not with cracking sounds. I did feel some improvement in my symptoms the next few days. Also, I have started taking a supplement that restores the sodium-potassium balance in the cells. Well, here's the problem with that. Your adrenal glands is the glands that deal with the sodium-potassium pump of your body. Your kidney and adrenal glands. Your adrenals are sodium, your kidneys are potassium. That's where your weaknesses are. You can take the supplement, but it doesn't fix the problem. You've got to go after the kidneys and the adrenal glands. Very important. You could take a glandular for the adrenal glands initially, say a 400 milligram glandular, say for a month or something to help get some energy to those adrenals. But ultimately, you have to get your kidneys filtered because it's the lymphatic system that you're having trouble with. Now, in chiropractics, you look at your skeletal system, whether it's axis or your upper C-spine or whatever. So the question is, what controls the spine and keeps it in alignment? Your muscles. So when you have muscles on one side of the body, one kidney's down, and your muscles are backing up, getting tighter on one side, they'll pull the other side out. And a chiropractor does his best to go in. That's where kinesiology came in, helping to relieve that lymphatic pressure and that pull on the spine. And then, of course, you get an adjustment, but it only lasts for a short period of time because you have to effectively go in and work with the muscles. Well, there comes a massage therapist. So you can combine massage therapy and chiropractic. The problem with the massage therapy is you can knead the muscles and move lymph around, but then it comes back too in a short period of time. So what's your final answer? Kidney filtration. And I'll stand that on my deathbed. Kidney filtration is the key. Whether allopathy understands it, modern physiology understands it, who cares? You're talking about theories trying to understand actualities. And when you can prove it through years and years of clinical work and curing people of all these things, that common sense sometimes is a lot better than theories. Sarah and I were talking about that this morning. Some of you are questioning about how the lymphatic system dumps in the kidneys. Good question. Pat's a 25-year A&P professor who teaches medical doctors what they know about the body. She can't even answer it. None of us can. But then, again, the same teaching philosophy of physiology teaches there's no lymphatic system in the brain. Well, we know better now. And what about the neurological connection to, let's say, the pancreatic production of insulin? Nobody even talks about that even today, and yet the university discovered that there's neurological weaknesses, neurological diabetes 15 years ago. I mean, it's just you have to kind of open up yourself spiritually and understand that common sense rules, awareness rules. And we were laughing about this morning, here's an old country boy, old hippie guy, living out in the van, having out-of-body experiences, peeing in a jar, seeing sediment in a jar, going, wow, look at all that stuff I'm getting rid of. I wasn't conditioned to think my urine should be clear. And so, like I said, later on when I became a biochemist and a naturopath and I was doing blood work and urinalysis, these urinalyses were coming back clear, and I'm going, clear? It didn't make sense that your urine should be clear. And so that's where this all just started. And ever since then, and I've been working on all of you guys getting your kidneys to filter, we're seeing the tumors coming out, and I've learned thousands and thousands of patients that you don't get kidney filtration, you don't get better. I don't know. We all don't know some of these questions in physiology, but then when a professor tells me that cell mitosis is still a theory, I'm going, what? But the chiropractor is probably right. You're being pulled out up there because you're chronic up in the sinuses and all this area there, and you can be easily being pulled out there in the atlas, and even in the upper C-spine. It would not be at all surprising at all. I don't see anything iridology-wise that would suggest, other than lymphatic stagnation, that you would be having that problem down the back at all. Matter of fact, you have pretty good genes. You're just chronically involved lymphatically, which is a hardening and an inflammatory issue involved in you. Your skin is down, your kidneys are down, but your kidneys, you can rebuild those pretty decent. Your left kidney, both kidneys have some chronic issues with them, but your nervous systems are down chronically. Again, that's all up in the head. See how dark that is? That's chronic lymph. Back of the head, a little bit more mastoid than anything. This is more up in the cerebellum areas. But you don't see any big, down here, this is what I was saying, in the groin area and the left hip area, that's the only one place you really see a lot of more advanced weaknesses. Maybe a little bronchial trunk over here. Maybe the thyroid, parathyroid here, but your whole thing is lymph, acidosis. And with that, your muscles can pull out your spines. And like I say, everyone tries to help you therapeutically, but in reality, you got to roll up your sleeves and get yourself hydrated, get your kidneys filtering. Then when the chiropractor helps to keep you adjusted, it'll stay in alignment. So that's all great to use chiropractors, a good massage therapist that knows kinesiology, or a chiropractor that knows kinesiology. All these are working to help you. But you got to remember, kidneys must filter, or you're just moving things around, and that's why you go back, and you go back, and you go back for treatment after treatment after treatment. You got the roller bed, a chiropractor's roller bed. Oh, I can live on that. I wish I'd have gotten Jensen's, but I didn't have a way to get it from California to here without costing me a lot of money I didn't have at the time. Also, I have started taking a supplement that restores. It doesn't. You can't restore something when the glands responsible for it is not healthy. It doesn't. Supplements don't restore the body's ability to fix the sodium-potassium pump. You have to fix the tissues involved in that, and that's going to be kidney and adrenal tissues, man. It might help the symptoms out a little bit, but at the same time, you have to be careful there. And balancing body chemistry is not smart. In the cells, it's called NIC-RCK. It's from Professor Bantanella from Italy. It made me feel better, like boosting my energy, improving my balance. No doubt of that. But you got to fix why. Always ask yourselves why. And that goes back to cells, structure, function, and its influence is by blood and lymph. And blood is always alkaline unless you want to terminate your physical body. I went another chiropractor which did an actual adjustment. He says my issue is not the atlas, it's forward leaning posture and lack of circulation to the brain. I did see some improvement, meaning for a few days I actually didn't have any balance issues and had energy. One day last week I lifted something heavy and the balance issue came back. Sometimes I don't have it and eating triggers it. Yeah, because you got all this vagal nerve, you got all this in the stomach and all this stuff in the nervous system and the autonomic. The stomach is the solar plex area, the brain of the autonomic. So any proteins or any acid-forming foods could trigger you off big time. Fruits would help you actually considerably. So you would want to move to a fruit diet anyway. Get this lymphatic system hydrated and opened up. These pics are what an iridologist booked for me. I appreciate your help. Thank you, Moses. Still something to say. Now that's the spot on the left side that's a little more advanced. Yeah, this is the sclera, and this is just showing you where where a lot of the inflammation is. If you look, your blood vessels are pretty enhanced, but look how small your pupil is. And she's got a fair amount of light there. But if you get more to the side with a 45-degree angle flashlight, and you get your camera up closer, you'll get a better pic. See how you can see these deep areas? And that's a much better picture. See, and here's the light at a 45-degree angle. When you do a straight on, which looked like what she had, and I had a ring flash on my first camera, I wasn't happy with the pictures. And once I learned how to do it differently, I redesigned my camera, and I put these fiber optics to the side, and that's what Jensen did with his cameras, and really made a difference, made you a much better picture. All right. Man, I've been talking for days. I've got a coconut festival to go to this weekend. I said I'd come up and speak at it. I thought it was just a little gathering, and now it looks like there's going to be a lot of people, and it's like, oh man, I'm going to go relaxed. This is Jacob. Jacob, we got all males today. Jacob from the United States. This young man is only 20 years young. 6'4", the opposite problem. Still, I'd be looking at his pituitary. I would be. 6'4", dang right. He's 200 pounds at 6'4". Overview, got a tonsillectomy, oh no, and an adenoidectomy in September 2024. Deeply regret it. Yeah, because these are lymph nodes. And I swear these medical people, God, oh, they've just never learned about mucus-forming foods, congestion, the lymphatic system. That's the furthest from most of their minds that there is. They're trapped in diseases, trapped in blood concepts, things like that. And it's like you have a whole system in your body that's at least as big or bigger than the blood system, and you don't know anything about it. And your theories are that your sewer system dumps its waste back in the blood. I mean, some of these theories, and that the kidneys really have very little purpose other than to pee. Ouch! Ow! Ow, baby. Crazy. Now listen to this. I don't know where you want to go with this, young man, but tonsils grow back. I know people with third sets of tonsils. So if I was you, and I really regretted it, I would hit a 100% raw food diet with at least 90% fruit, berries and melons. And I would work on my lymphatic system, because that's what your tonsils are tied to. They're not tied to your blood, they're part of your sewer system. Showing me that you're backed up, that you have probably colon problems in terms of lymphatics, kidneys maybe not filtering, because you had to get pituitary problems from somewhere. Same as the lad before you, but short instead of tall. We're going back to the same area, the transverse colon. We're going to be looking at your sinuses from that, your head area from that. And when your tonsils swell, that means your lymphatic system's backed up. Now the problem, and one thing I can't take, is we all have looked for years, what cells now can't be drained properly in your head and neck area or brain area because of this now. Remember, your lymph nodes are vital to the drainage of your lymph system. If you consider them internal septic tanks, and that they come before the kidneys, and essentially so, because a lot of kinetic waste in your bodies are down around a 3 to 4 pH. That's not good. That's like, oh man, that hurts when I pee. And so, 3 to 4 pH breaks down tissues, breaks down cells. That's how you get an atypical in a cancer cell. And yet they're willing to give you a 2 pH or a 1.5 pH chemo, knowing that they destroy cells right off. I mean, that's a no-brainer. Coke destroys cells, and that's 2.5 to 3 pH. What? I mean, it's just like no brain power sometimes in some of these people. I don't know what it is. So I'm just saying, you had this done in 24. I would go to try to see if their body will grow them back. Now that depends on your genetics and how strong your body is and all that other stuff. But I've had a thyroid go back on a lady. I had a spinal bifida case where L4 and L5 grew, which she didn't have them before. I mean, the body does things like, whoa, baby. I mean, it's unreal. Remember I told you the quad we had? He fell out of a wheelchair, fractured his upper right femur, ended up pulling his right leg 2 inches shorter than his left, He had extreme scoliosis when I met him, to the right. Big old shelf right here. Been a quad for I don't know how many years. Trampoline accident at 17. He was 57, I think, when I met him. Long time quad. 11th month. Now, he didn't go all fruit, but he went all raw. His neighbor would make him green drinks and things. And I said, you got to go, well, I need more connection. But his 11th month, his wife went to dress him. He worked in the detective department down in the sheriff's department. And she goes, oh my God. And he goes, I saw it, oh my God. His leg pulled itself straight. He had a bulge here in his femur. It just like pulled itself straight. And his legs were the same. And his spine pulled itself straight. No more scoliosis. And it was like, what? Even I went, what? I mean, it's like, whoa. But that's when you're up at that high level of all raw. Can you imagine a high level of all fruit? What that could bring to the human body? When you can cut yourself, you don't bleed, and it heals the next day? I mean, that's where I was. And it's like, holy crap. Even Arnold Ehret talks about that. It's like, where can we go with this? Right? What can we regrow in the human body with this? So, I'm just putting it out there to you. You got to fix your lymph system anyway, or, now without tonsils and stuff, trouble with neck tumors and stuff like this can be real possibilities. And it's like, no. You're only 20. Yeah, just wondering if they are possible to grow back. Hell yeah, baby. Started on all fruit diet. Yeah. All right. My goal is 3 weeks from now, but hoping I can do 3 to 6 months. Yeah, go for it, man. Go for it. Grow your tonsils back and it will shove them in their throat. Honestly, it is appreciated. You don't get anything but honesty with me. I don't care what you ask. If I don't know, I'm going to tell you. I have no ego that way. I could care less. I only know what I know through how many years? 52 years now of being a naturopathic practitioner and working with all of you guys and having schools and classes and I don't know, outside of that. But you'll always find that with me. You will always find straight, bro. Always. And that's a hard thing I had in seeing people, because if I didn't think you would make it, that was a tough call for me to say, I don't know if you're going to make this. That's a tough call because I don't work in that world. You can't tell somebody, oh, you only have a week to live or a month to live. People come to me with a month to live, a week to live, and we've cured them. So it's like, yeah. And then I've had others I couldn't. Not a lot, but a few. I remember this one big black lady. I got her out of the hospital out of pain. I went to her house and visited her. All her kids were around. They were hugging me, and she said, I know I'm not going to make this, but she says, I love you. She says, I'm not in pain. I said, that's good. But those cases can get you. But she was pretty big, and she didn't make it. But I worked on her as fast as I could, but she was very advanced. But I got her out of pain. So she didn't die with pain. So, Jacob, go for it, man. Yeah. There's a lot of things that if you're going to get a new body, it's still better to start hooking to the natural health field. We're a huge, huge field. We're so much bigger than allopathy. We have a huge field, the natural holistic health field, from chiropractics, massage therapists, acupuncturists, homeopathy. I'll throw in there as well, even though they're treatment-based. They're still non-toxic treatment-based. I mean, we're huge, a huge field. Color therapy, sound therapy. You can go on in all these sciences of nature. Smell therapy. Matter of fact, that's the last video I'm going to do for your class, is I'm going to do a sound, color, smell, sight therapies. Show you how each one of these can impact the body, because each one are hooked to duality. each one of those have the positive and enhancing side, and each one of those have the negative breakdown side. Each sight, smells, sounds, all these have the alkaline side to it and the acidic side to it. All things in creation have the duality to it. And if you want to get to Wellville, you want to live on the positive side for a while. You'll balance out. This is Poland. Anna. Hey, Anna, 49-year-old woman, 5'6". Still be looking at that pituitary a little bit, maybe, just for the heck of it. Retinal detachment. Oh, no. Oh, this is rough, brother. Retinal detachment and degeneration, corneal thinning, bloating, and low thyroid. Right here. See, we have a lot of people that have got a lot of head problems. And that means your lymphatic system, sweetheart, in your head. Hey, do you have pictures? Oh! Because all of those, when you see corneal thinning and all this sort of thing, what destroys or breaks down tissue? You only have two sides of chemistry, and literally everything in this physical world gets its energy one side or another through chemistry. These, like it or not, the physical worlds are the worlds of chemistry. And you always go to that for your answers. So when you see thinning, hardening, breaking down, changing of morphology, and structure functions, which side of chemistry you're going to, you only have two. Sorry. Whoa. Boy, you have some lymphatic problems. Whoa. Look at all these radius solaris. Look at this skin down. That's a hypothyroid right there. Is she pituitary? What do you think that is? Look how dark that is. Right side, what do you think that is? Chronic pituitaries. Kidneys aren't so bad here. We'll take a look at these things. But see how puffy this lymphatic system is? Look at their lymph nodes hiding, but swollen all over the place. The question is, what color of eyes do we have here? Just some nerve rings, I think. Retinal detachment and stuff like that. I mean, you've got to move lymph. This is where I would use the blood formula, the circulation formula, to get blood up into these eyes of yours. At the same time, you've got to remove what's breaking your tissues down in your eyes, but also in your brain, because one day it'll be, honey, where did I park the car? I mean, that's where you're going. And you don't want any of this. Bloating, that's just tied to this. That's, remember, let's see if I can draw this one halfway. When the cell opens up, fertilized cell opens up, begin to see the embryo. This is the embryonic trunk, the tadpole trunk, I call it. That's your spinal cord, your GI tract, and all your organs and glands come out of that. That's why we often refer to a lot of your organs and glands as wrapped with gut tissue. So there's that symbiotic relationship always. That's why we talk about the importance of raw foods and the importance to have the bowel wall and the interstitial areas cleaned. So the electrical transference, as the enzymes break down your foods, it releases energy. All these kickoffs release energy. And that energy is picked up neurologically and sent to the related areas. Because in the final analysis, it's all about energy. Whether you talk about minerals, vitamins, whatever, you talk about salts, whatever, it's all about the energy they give off when they're broken down. or the energy they take. I've been struggling since I was a baby. Oh, honey. Raised on a baby formula. Oh, God. Then this is so, I don't know. You know what? We all fall into these things that I just feel so sorry. But this is typical around the world. This sweetheart was raised on baby formulas. Thank you, biochemist. That's why I hate to tell anybody I'm a biochemist. No, I don't. Baby formulas. High meat, dairy, and egg diet. And it's no wonder. Your body looks it. Lymphatically speaking, looks it. And this is the problem. None of these foods are fit for humans. These baby formulas, these guys don't even know what they're talking about. It's unbelievable the amount of kids that are raised on these type of diets. You have nothing but trouble. And this sits on top of their genetics from parents who were raised that way, and grandparents that were raised that way. And this genetic downslide, I call it, is horrendous. That's why I often thought, is the human race actually going to exist in the future because of this genetic downslide of cells? I've always said the cell morphology now, the condition of the cell in terms of structure and function, is as weak as it's ever been. You got 15-year-old, 20-year-olds experiencing things that only older people used to. Horrible. Was always sick, yeah, and always used antibiotic treatments, killing the bacteria in the body. This is where the medical world and their I know it all and their narcissism is taking us. If they were truly a health modality, they would have helped us keep informing the public that milk isn't good for you. Oh no, you get slammed for saying stuff like that. I don't know what you're talking about. We were talking about C. Everett Koop, the United States Surgeon General, made the fatal mistake of telling the people of the United States milk isn't good for them, and they fired him. Dr. Spock would bring that out. I have these articles somewhere around here. Nah, you can't tell the truth. Moses, that's the other problem. The truth. Jacob. Yeah, truth hurts, don't it? I try to, if someone's in serious conditions and stuff, I'm going to say the truth, but I'm going to be real humble and compassionate about it. But lying is not something you ever, I was raised in a world where you don't lie or you get some butt whipping. You never lie. My family couldn't stand liars. When I was 15, I was diagnosed with uveitis. Months in the hospital, steroids, laser treatments to prevent rectal detachment. And see, that's the problem. Had she come to a naturopath that knew what they were talking about, remember, we're just bringing out the lymphatic system really more than anybody ever has on this planet. You're involved in a group that we brought out the lymphatic system like it's never been brought out before. But then it starts to answer all your questions, doesn't it? Now you start to understand. You didn't just develop this out of nowhere. Chemistry. And the chemistry you were given growing up is predominantly acidic and congestive in nature. And then you treat that. Can't treat that. Because this is what happens when you treat that. You're going to lose the tissue anyway. And then some of the therapies probably add to this. Five years later, retina in my left eye tore apart, leading to yellow spot detachment and vitrectomy surgery, whatever that is. It caused side effects, post-surgery glaucoma, and lens replacement. Well, that's just pressure. Glaucoma is just lymph pressure, man. Just lymph pressure. And it's just part of understanding what the problem is. This isn't blood pressure problems. This is lymph pressure. And I'm surprised they don't know that at least. Because there's only two fluids in the human body that can yield you pressure. Blood and lymph. And lymph pressure is, that's the one that's the killer, because you can't take a pill for it. She's had a lens replacement. My both eyes are still at risk of retinal detachment. This is why you've got to get up in there. I would use cell regen formula, my cell regen formula. I would use nerve power. I would use blood circulation formula on top of kidneys, on top of endocrine glands, on top of the bowel formula. Get the first kit. You start to move on that lymph system. Go after getting that kidney filtering. I would double dip on the lymphatic, on the endocrine gland formula. Again, getting the cell regeneration. It's going to start strengthening tissue. These are strong adaptogens. So you're like tonics. They're going to strengthen cells. I'll be going after that. Look at my parathyroid gland, because look at your fingernails and stuff. You want calcium utilization. You want to stay strong in tissue. So I would put you on a parathyroid glandular anyway, twice a day at least. And I'm going after you, with things that are not just lymphatic. I'm going after cell regeneration formula that we have. I'm going to start trying to strengthen tissue, even in acidic mediums. I'm going to move blood more aggressively to bring more alkaline chemistry into that area to back off those acids a little bit. All of that, I'm going after you. Going after breaking that, going that neurolymphatic down your back. Have your husband or whoever work on that neurolymphatic system twice a day, 3 times a day. Find a massage therapist that knows that. Start breaking these lymph nodes loose. All this, moving everything toward the kidneys, not toward the heart, toward the kidneys. Hot and cold on the back of the head for sure. When you do a shower, hot and cold, you want to stimulate and move. Sweat. If you can get your thyroid up and get you sweating, get yourself sweating. Make sure you get your kidneys filtering. You want to see a lot of sediment sewage in those kidneys. Break this stuff loose. The quicker you can break this loose, the better off. Everything will start slow back up and start to heal. And that's what you want. Using herbs like the cell regeneration formula that we have will really help to strengthen cells up. Again, moving blood more aggressively, a blood circulation formula. I probably do nerve power just because of its power and the neurological connection to the retina and the iris and all that, the pupil, the cornea. I'd be enhancing on that one as well. And I'd be going after this, because losing your vision is not an option. Damaged by laser treatments, that's what I'm saying. You friggin'... yeah. And I don't even want to say they mean well. A good surgeon might mean well, but laser treatments. I've been plant-based most of my adult life. I've been on raw plant-based diet, mostly fruits, for 7 months now. I would live exclusively on fruits if I could get there. I was high raw before with cooked veggies for dinner. Doctors don't give me much hope. Yeah, I would start using herbs. I'd start using herbs more aggressively, sweetheart. I really would. Diet's not near enough with this kind of problem. And again, you want to use that. I have a great eye formula. I would use that as well. Eye Bright, a lot of the bilberry, butcher's brew, things like that, move blood more aggressively in the eye tissues and things like that. So the eye formula, I have eye regen, cell regen. I'd be on all of those and hitting them. Hitting them at a good rate. But our eye formula, another thing you can do is get an eye wash and wash your eyes at the same time. That'll move more blood and lymph aggressively in the cornea and stuff. That'll be very helpful, doing that and getting on these herbs. There's a certain diets are perfect, fruit levels are perfect, but the herbs are magic healers. You want to grab a hold of these, especially when you're such a stat need for this. Is it possible to regenerate retinas and eye structure damaged through treatments? Absolutely it is. But not a snap of a finger. And that's why the botanicals and some of these adaptogens are really important, especially in the herbs for the eyes and stuff like this. Like I said, Butcher's Brew, Bilberry, all these things are incredible at strengthening vascular walls, moving blood more aggressively up in eye tissues and stuff like this. Same with Eye Bright. You know, these herbs are just incredible for that. So I'd be using that for sure, along with my cell regeneration formula, start strengthening cells in the body. But I'd be looking at my endocrinology, my parathyroid. You got to be able to utilize calcium for all this to take place as well. You want your adrenals, your nervous system, you want your kidneys filtering. You got to move your lymph. And you have a chronic pituitary. And you want to get all that going because that controls everything. So your sinuses, all this has got to break loose, sweetheart. And your bowels, got to clean the bowels up. Laser burnt my oh yeah, no, there's scar tissue. I know. It's like sun gazing. People thought sun gazing. I said sun gazing. Who ever thought of that? And of course, I've heard of it for years and years back. And now I have people come to me that had scar tissue in the eyes. Oh yeah, stupid stuff. Oh my God. There's so many low aware humans. You got to be real careful what you buy into, because it can damage you for life here. Peripheral retina scar tissue. I also suffer from dry eye syndrome. Of course you do. Now, what side of chemistry dries you out? First thing, when you start feeling dryness in your eyes, and let this be a lesson to all you guys that are feeling dry eyes, dry mouth, and all this. What dries you out? Acids. Acids doesn't come from the blood. It comes from the lymphatic system. So you see how all that's tied together? Yeah. So when you start getting dry eyes, oh no, use the eye wash, start promoting blood and lymph, but you want to get your kidneys filtering, start moving all these tissues, because here you got teeth and gums. That can be affected. Oh yeah, not just the eyes. Still struggling with a terrible eye pain, lymphatic stagnation. Actually, what is puffy eyes? That's your kidneys down, honey. Absolutely. It's all down. Bloating, low thyroid, cold hands and feet. Absolutely. Hair thinning. Yeah, you're way acidic up here. Way acidic. It looks like you're acidic all through you. But if you look here, you can see it more in her right eye. She's a lot more impacted up here in the sinus areas. See how she's a lot more thicker lymphatically than say right here even? Chronic around the bowels. See all this? Look at this. Yep. We'll look at this real quick here in a minute. Hair thinning, yeah. I mean, it takes off hair. I mean, that's what acids do. Strips you down in your body and tears it apart. That's what acids do. Dries you out, strips you down, tears you apart. And if the medical doctors don't understand that, then the next question is, well, how did my body get acidic? Not through the blood. Oh, let me see. There's only one other fluid-based system in the body, and everything else you could name might be a little water. Geez, that's not real difficult, is it? Don't tolerate low temperatures. No kidding. Your thyroid is may I also ask, what's your opinion on drinking celery juice? Can't hurt. Can't hurt. You can add a little cucumber in with it as well. Can't hurt. I don't have a problem with celery juice. Thank you very much. Make sure you have no pesticides on it for your guidance, Anna. Oh man, honey. Yeah, you have real chronic around your GI tract. You have a malabsorption ring as well. Your skin is way down. That's your thyroid though. Looking at your left side, you definitely have genetics in your thyroid and parathyroid. Not heavy, but still there. Your pituitary is chronic. Back of the head, you have some weaknesses going on. But I tell you what, oh, God. I'm just going to say I don't know. But man, I see a lot of blue in your eye in places. That would make it so much more serious of a situation. But if you look, you see blue. Blue. There is absolutely no blue in a true brown eye. And it's possible. It's possible. You have to ask your mama what color eye you were born with. Spleen, you got some spleen. You get chronic lymph, no, chronic pituitary. Your right chest wall here, be careful with this right breast. The right breast is genetically weak. The feed to it is chronic. Be real careful there. Got some chronic buildup in the lower lobe of your right lung. Wouldn't hurt to clean your liver out. But in your lower extremities, groin is weak on the right side. Real minor weakness in the femur. A lot of heavy lymph in the kidney. Definitely genetics in your kidney. You've got nerve rings, so you have a little bit of a chronic nervous system. Left side, you have a chronic adrenal, chronic kidney, lower ankle area, upper femur a little bit. Your hip on the left side is not a happy fella. A little bit of pancreatic, left ovarian weakness. A little more thyroid, parathyroid weakness, not heavy. You should be able to help that. Your upper neck, you got some weaknesses in the upper neck here on the left side. Back of the neck. Yep. Be careful with feeding the heart, chronic lymph. I'd go all grapes, sweetie. I would go all grapes. You know, sweetie, you're a serious case here, and you don't want to play around with this. Think about our iRegen formula, our cell regen formula, these sort of things in terms of immediately trying to get these cells strengthened up. Definitely take the parathyroid glandular. I definitely would do that. Thyroid, if you're too low, you could add a low thyroid glandular, but you only want about 20 milligrams. You don't want to kick it too hard. But you could use the endocrine gland formula to help the thyroid gland. I'd be double dipping it because you got pituitary issues going on here. And you've got to turn that on because that actually shuts all the other ones down on top of having them a little weak too, genetically. So you've got some work to do. You've got to get those kidneys opened up and filtering. That's key. That's your key to unlock this doorway and stop this, because you can't make this acid that's drying you out and tearing your retina and all this apart. You can't make them just disappear with supplements. Oh, take vitamin C, it'll make it disappear. Really? Right. You can't do any of that. This is real time, real chemistry. There's real channels in your body for blood and lymph flows to move chemistry in and out. There's no magic to it. It's all chemistry. This is Elsie. Elsie is 36. Whoa, 36, honey. 5'6". Obviously a female. 80 pounds. Whoa! You're skinny, honey. Chronic pain, healing journey. Yeah. See what we got. We got some pictures. Oh, yeah. Ah, look. There she is. Is that a before and after? Because on that one picture, you look so much better. Holy crap. Look at this. Look at her kidney bags and all that. And looky here. Let's see if that's an improvement journey, because same weight, face fat, edema, and whole body is swollen and puffy. Well, I can just tell you that you look like your kidneys and all this are showing real bad in the first picture. That doesn't show good. This shows better, whether you're puffy or not. All right, you ready for this? What is all of this yellow stuff and white? What is all of this thick yellow stuff in a blue eye. You're just sitting there, or just found its way in there as a color. Now you notice here there's a little prolapsing of this transverse colon. See how it's going up here, but then it kind of sags here? Yeah, there's a prolapse. So that's what takes you to the parathyroid gland. Whoa, 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 whoa. Yeah, look how little the pupil is, malabsorption ring, of course. Kidney area. This is her upper neck, upper back area right here. Look at that. And look at how much lymph is stuck in the middle of her back. Look at this. And look at the bowel. Look at these pocketed areas in the bowel. Look at this. You didn't really clean up your GI tract, sweetie. Here's a little bit of a spastic area of the colon or small bowel. That's actually the colon. So, let me see here. Let's look at her eye before I read this. We know we have, this is subacute, but it's thick. That's thick lymphatic stagnation up in your sinuses, your frontal lobe here. Be careful there. You can lose hair up here in your frontal part of your head. Definitely thyroid, parathyroid a little bit. Upper neck. Your weakness in your left chest wall. Your upper femur on your left leg. Your femur that goes up into your hip is weak. You got some weaknesses in the hip, not too bad. Kidneys are weak, but not heavily so. More acute, subacute. Maybe a little weakness on the vaginal wall or rectal wall, but either the bladder or uterus really backed up lymphatically. The right side, the light really picked up these bowels. You've got like, I wouldn't call them diverticulums maybe you've got a lot of weaknesses on your bowel wall and in your stomach area. So, and you've got malabsorption. Probably why you're so skinny. You've got a lot of lymph stuck in the walls there, but you've got weaknesses. So you want to be on a bowel formula for a while, not to move you, to heal you. You know, to help pull this inflammation out or the acids out, and to strengthen the bowel wall. Your right femur, upper femur. That's why I say you want to put yourself on a parathyroid glandular. Stay with that for about a month or so, because I see skeletal problems, and your upper right femur going up into your hip is very weak, almost down to the knee. Ankles can be influenced there on that side. A little bit of a chronic kidney on that side, the right side. Scattering weaknesses down the back. But again, more evidence of parathyroid, thyroid weakness. Little minor pituitary weakness. That's it's not real chronic, but it's at the subacute level. It's enough to give you a problem. And I also consider maybe the pineal gland down a little bit. But you got to drain the head, and some of this could be sulfur, but I'm not sure of that. Thyroid, parathyroid. Right there. Upper femur. So, let's see what we got going. I am bloated and exhausted after I eat. Yeah, I mean, you've got a lot of lymph stuck in there. Oh, and while we're looking at that, here's another reason for that. And a tad bit on the gallbladder, but honey, you've got a pretty good pancreatic weakness. And this also invading the right ovary. Look at that. So you're not digesting your foods probably properly. So this is what I'm going to say: chew, chew, chew. You want to stay on an all raw diet. Stay away from vegetables as much as you can because you don't have the digestive power for that. Stay mostly on fruits. They're the easiest to digest. Fruits, berries, and melons are the easiest foods to digest. You definitely don't want proteins. Your bowel walls are not happy fellas. Really showing a lot of weaknesses along your GI tract as well. So not only I think you're not digesting your foods properly, you're not absorbing your nutrition well. So basically you're in starvation mode. Whenever you feel bloaty, yeah, that means you have fermentation going on, you have acidosis going on, and you could be holding water. And it's never good to hold water. Just never good to do that. You want to go after those kidneys. Very, very importantly, your right kidney is not a happy kidney. And that's where you see a lot of these weaknesses on your right side. So really want to open that doorway, get your kidneys filtering, that sort of thing, and fix this. You really want to fix it because you have a lot of lymph stagnation there, especially on this right side. Look at the difference lymphatically on this is the right side, and this is the left side. Look at how much more lymphatic problems she has. And that's this old kidney here. Not a real happy camper. But you see it in your eyes. You're sunken in there. I have been dealing in chronic pain for 10 plus years. Oh, man. Well, but I can see why. Your body's just very acidic. Very acidic. And that's, there's only two sides of chemistry. And you would never, in your level, say, I'm very alkaline and I have a lot of pain. No. You're very acidic, especially on that right side. And you could have a lot of pain there as the interstitial areas back up, back up, back up. Look how thick that looks. Fibromyalgia, there you go. Fibromyalgia, lupus, Lyme's are all the same thing. Arthritis is systemic acidosis. You fix them all the same way. You could say basically you have systemic acidosis. Whatever name the medical doctors love to put on that crap, that's lymphatic stagnation head to toe. And nothing good comes of that. Chronic pain all the time. And that's no fun. You can't take steroids and aspirins and all that all the time, can you? And ruin your liver and everything else. But you're also not digesting your foods properly. And that you want to do. But you want to be on fruit, and more fruit. I'd be living on a grape diet. Stay away from the pineapples and the acid thing because your body is very acidic. If you have to do a salad or green drinks would even be better because to me, you don't digest well. If you're going to eat salads, chew, 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 chew. 50 times. Chew, 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 chew. Everybody will be done and gone off of out of the kitchen while you're still chewing. Because you gotta let your digestion take place in your mouth a lot more because of what I see in the pancreas. The hypersensitivity to smells, sounds, textures, temperatures, tastes is debilitating. Honestly, sometimes it feels like I'm allergic to life. Your sewer system's backed up, that's why. Your immune sewer system is backed up badly. And that's why the chronic pain and everything else is swelling everything, nerves and everything else, making you hypersensitive to everything. So you got to cool everything down. And you can only do that with a fruit, berry, and a melon diet. And I'd go light on the berries, to be honest with you. Dates and figs, okay. If you got to do green drinks, okay. But I would even wash them around in my mouth, too. Now, herbal-wise, you want on kidney formulas. I'd take 2 kidney formulas to start, and then in your second kit, do a kidney and a lymphatic formula. Because you got to start hunking on this lymphatic system, right? So you want the 2 kidney formulas of the handcrafted side, right? The endocrine gland formula, you've got to start perking everything up. I'd also get on a parathyroid glandular, right? That'll help you utilize calcium. That'll help with pain in the bones and things like that big time, right? And strengthen your connective tissue up. You have the endocrine gland formula within that first kit. The bowel formula, you've got to work on your bowels. You look at your GI tract on the right side, and you've got a lot of dark areas all around, almost like you're full of diverticulums or bowel pockets. Now, you could have impactions, heavy impactions on that bowel wall, and you want to start pulling all this off. That's why you see a bowel formula with that. Blood circulation formula, yeah, you can, but I would do the liver formula, comes with the first kit, and then I would use our pancreatic formula, because you need to enhance the function of your pancreas. But the liver herbs do that as well. They help enhance pancreatic function as well as liver function. And I would be enhancing the function of these tissues, because you've got to start digesting better. And when you don't digest well, then you've got to chew more. You got to start digesting here, because this is the same digestive process as the pancreas almost. One thing you don't want to have in pain was what? Protein. You don't want to have any protein. Nuts, seeds, grains, beans, dead animals. No way in holy crap, when you're in pain, do you want to have those kind of foods, or you're going to have more pain you can't get rid of. Hell no. Grapes, apples, applesauce, pears, peaches, mangoes, dates, figs, stuff like that. And live on them. You're a frugivore anyway, frugivore body. You're not allergic to life. Your body's just backed up in sewage. You're way too acidic, sweetheart, and you can fix all this. You can fix all of this. That said, I know I still have lots of healing to work on. Yeah, until you're totally out of pain, you see nice blue eyes. Where are you at? Come here, baby. That's what you want to look like. You want all this thick yellow stuff out of there, baby. Out of there. I've been down the conventional route, to treat everything. Yeah, how do you treat systemic acidosis? I have been working in the natural, raw, herbal space for the next 4+ years now. Good woman. It's still overwhelming at times, and I feel like I'm missing some things. Well, keep it down. Bring it down. Bring it down, girl. Keep it simple. Keep it simple. Look at our kits. Keep it simple. Keep your focus simple. You have a lymphatic system. You have a sewer system that's down. Keep it simple. You have a pancreas. We went over your eyes. You saw everything that you're involved in. Relax. Keep it simple. But you have to go after your endocrinology, your pituitary, your adrenals is where your steroids are. I mean, you got to start moving lymph, get your parathyroid up so you utilize calcium. All this will help pull the pain out. Get yourself hydrated properly, which is raw foods. You know, keep that blood nice and alkaline. Get those kidneys filtering. Key to your success is kidney filtration. So I was praying you would look at my eyes and give me an idea of where I'm at. I would be so grateful for your wise insight. Much love, Elsie. Hell, sweetheart, that's why I'm here. Get you pulled out of this so you feel like a good woman again. Get out of this systemic pain. There's nothing ever good comes of that. But, you just got a little work to do on yourself. And you got to do it. Your eyelashes are kind of thin. You be careful because you start losing hair, especially up here in this frontal lobe and areas like this. You're too acidic. And you're malabsorbed as well. You need to put on some good muscle tissue and things. Well, you can't do that when the body's highly acidic. You're breaking down cells. You're not absorbing your nutrition. How are you going to put on nice muscle and get your body back to Wellville again? So you might be going through some ups and downs here, sweetheart, going through this, but go through you must. Get out of that rabbit hole you're in and pull yourself and head your train to Wellville, honey. We're here for you. We got a whole bunch of people on the internet for you, and our Grape Gate, and all our students. So there's a lot of people here. Let's all give her a big hug, everybody. Hug, Elsie. Hug, hug, hug. You'll be okay, honey. You'll be okay. All right. Let me see. Look at the time for one more. Yes. This This is Valerie. She's from France. 58 years young, 5'6", 112 pounds. Need help for a kind of breast tumor. All right. Question. What system do you have down, Valerie, when you have a tumor? Is your blood down? No. So that only leaves one other system that you have down. And that's the one system that the medical world has no clue. That's why all their therapies for tumors and cancer kill the majority of people they treat. Something wrong with that picture? So you don't want to fall into that issue. You don't need biopsy. You don't, hopefully you haven't. You don't want any of that stuff done. You want to know, look, I've got a tumor. It's my lymphatic system. It's backed up. And that kidney on that side is not filtering properly. So I need to get my kidneys filtering. So filtration of the kidneys, big mystery. There's no question, even in my world, big mystery. Just can say that the kidneys get swollen on protein diets. They get inflamed as well. The lymph nodes are back up. So it's opening everybody up. And the only thing that does that is fruits, 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 fruits. Berries and melons. But berries are mostly acidic, so you have to be careful. If you're going to do blueberries, you want them nice and sweet. But your raspberries, when you're acidic and pain, you don't want to do any of those type of things. And there are fruits that are acidic, pineapples and stuff. Unless you're right there in Indonesia or somewhere, or Hawaii, where you have your golden pineapples in there ripe off the plant, I wouldn't do them. You want to be careful about that. Lemons, no way. Things like this, limes. Dear Dr. Morse team, yeah, we're a good team. And I to consider all you part of our team. This planet's craving for truth. Jacob says we want truth, and it's craving for truth. Well, and consciousness, and that's just part of creation. You have new souls coming into this area all the time, but that you also have older, more advanced souls coming into these bodies as well, thanks to you guys. And so we as a team are helping this world understand the health of the human body, which then will lead into health of their emotional body, health of their mental bodies, and help them at their journey to wake up. Or at least to have a more fun and better journey, right? So understanding the lymphatic system, keeping it simple is always important. Those that have the intellectual variety, they lose themselves all the time. There's something else. There's something else you got to research, something else you got to find, and all this other stuff. And it's like, yeah, there goes a lot of money and a lot of fear and stuff that they use to control people. There's that whole scenario that when you're diagnosed with the C word, like that lady that works with Trump, well, what's her name? She's got a breast tumor. Look, she's going to go the traditional route. All that hair she had on her head, got to be careful with that. I've had very good experiences from Dr. Morse and the herbs I take since 2018 with some pauses. Oh, wow. Good, 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 good. I hope so, because I'm not sitting here whistling Dixie for nothing. I could be home working in my garden. Nope. I'd rather be here helping you guys. In June 25, I started to take Lymph 3, the new version, as I wanted my lymph to clean. I had associated kidney and a GI renew with it, and endocrine gland, as I am postmenopausal since 2 years. Ooh. I did not have serious health problems up until now, and already had a diet mainly from fruits, salads, and vegetables. But in August, I started to have kind of a cyst on the left breast, and now it grew up to 7 to 9 centimeters. I had contacted the French consult that did training with you, and he gave me some recommendations, herbs, and other good practices. Yeah, now here's the thing. As you get up on these lymphatic formulas, they're stronger. And that's why we try to make sure that your kidneys are filtering before you take too strong of a lymphatic formula, because they can exacerbate things. They can make tumors grow when in fact they're designed to open you up. But you can't make lymph drain when the door's closed. You know, when the doorway to the outside world is locked down, you can't get lymph. You can only move it around like a massage therapist. And so sometimes it can create cysts and stuff. I've never seen much of that. I have seen it make tumors grow. And I remember this lady in Canada, she had several tumors, and she said, hit me with 2 or 3 lymphatic formulas and a kidney formula. I said, no. I said, it'll just make your tumors grow. She said, I'm going to hit my lymphatic system hard. I couldn't talk her out of it. Sure enough, she did about 3 lymphatic formulas and a kidney or 2 formula, and she called me back. She said, my tumors are growing. I said, well, I told you. Kidney filtration is everything, and I've learned this the hard way. I've learned this in every other way. If you don't filter in your kidneys, you're not going anywhere. Even if you're on all the good herbs and everything else, that's why kidney herbs are important. That's why this new handcrafted line, I put a lymphatic herb in every kidney formula. It'll be better in starting out, if you're not filtering, to take 2 kidney formulas. That way you're still getting lymphatic herbs in there, than taking a kidney and a lymphatic herb. And that's just kind of how we see it here and trying to help you with it. At the same time, when you have tumors, you want to get things moving. That's why fruit, and fruit only when you have tumors or cysts. But we are in December, and I don't see a lot of progress, even if I know it will not be instant to recover. Yeah, but it should be. I mean, you're looking at, when did you say? Oh, August, September, October, November, December. That's 4 months. So you should, in 4 months, you should see your tumors coming way down if you're doing everything right. If not, you've got some lymph node problems or something, or your kidneys are very chronic or something, because in 4 months, you should definitely see tumors coming down. I've gotten rid of tumors in 2.5 months, baseball-sized tumors. So I'm a little going, huh? Yeah. I don't want to have surgery, chemo, or other chemo. No. I cannot buy a lot of herbs. You don't have to buy a lot of herbs. The focus is where you need to be. So I would think, backing up, I would do 2 kidney handcrafted sign, kidney 1 and 2. I would take those 2 for a month or so. I might graduate after a month on 2 kidney formulas to a kidney and a lymphatic 1. Even start out with a half a dropper full of lymphatic 1. Go after your endocrinology, though, and go after your GI tract. If you can just do those few things, that'll be good. And then you have to eat anyway. So fruit, and I would go on a grape diet. The darker, the better. I would like to have your viewpoint on this, as maybe you have a similar case. And you have cases that are hard sometimes, Valerie. We do. We've had people not filter for 6 months. It's like, whoa. We've talked about this on other videos, how people have said that dates help your kidneys to filter. You know, you're in I'm even in a gray zone where I don't know everything about the kidney filtration. I just know it's central to have it. And, our A&P Professor Patty, 25 years teaching medical doctors how the body works. She doesn't get it all either. So all I can say is you got to think about the lymph nodes in the body and how they're doing. If you can't seem to break a tumor, and you're filtering, and you can't break a tumor loose, then there's a lymph node problem somewhere. And you could have an atrophied lymph node. I don't know. There's no eyes here to look at to see, but if you want to, Deb, we can maybe get her eyes here and take a look at that and see on that side of the body what's going on there, and see how much lymphatic stuff she has. Sometimes your lymphatic system is so much more chronic than you realize. But I don't know that. I would have to look at your eyes and see all that. But that's how I would progress on this one. 2 kidney formulas for about a month. Even if you did go kidney 1 and 2 and then kidney 3 and 4, you're going to have a lymphatic herb, and each one of those might be sufficient, because you're also hydrating with the fruits. I would set in on a nice grape diet. This is moving into the summertime now. Now this is a little older here, but we're moving into the summertime, and hopefully, more fruit and stuff available. Mango season and all this. Hunk down on those, that sort of thing. I would be working on my bowels and my endocrinology on the side of that. So you don't have to buy a lot of herbs, but the focus on the herbs is where you want to be. Right? And that's where I would go, sweetheart. And keep working with us, and we'll look at your case and see where you're at on that. Need a picture of eyes would be very helpful, and we can then go over them and see. And so, Debbie, see what you can do for me, honey. Love you guys. Dig in, keep working it, because no matter what, you got to keep working it. It works. But everybody's different level of genetics. Everybody's a different level of lymphatic stagnation, and so you just keep working it and do the best you can. But when you have systemic pain and things like that, some of these cases are really horrible. And you just have to keep working on yourself and realize what side of chemistry is involved in, what system is involved in, because that's the body. You can study A and P all you want, but that's the body, as simple as you can get it. A bunch of cells and two fluids, and there's only two sides of chemistry, and your blood doesn't deal with both sides. It's stupid. Your blood deals with one side, your lymphatic system deals with the other side. And it's the acid side that most people are involved in, not the high alkaline side. That's insanity. I don't know where medical doctors get off on that. But anyway, it's a deep pleasure to help you guys. And we are here to help you. So don't fear anything like that. Don't have fear. Just get focused. And it's not a bunch of herbs that you take. It's your focus that's important. That's always important, is your focus. All right. Love you guys.